All right. Well, thank you everybody for taking a little bit of time out of your day today and joining us. My name is Chris McCoy. I am the State Director of Americans for Prosperity here in North Carolina. And today we're going to be chatting with Representative Virginia Foxx regarding some issues that are important to us here in North Carolina. And, without further ado, I want to introduce our guest, and it's my honor to have the Congresswoman from the 5th District present with us today and joining us for this small chat. So, Representative Foxx, thank you so much for taking a few minutes and spending some time with us today.
Oh, thank you, Chris. Um, I'm a big fan of Americans for Prosperity. I have worked with North Carolinians in Americans for Prosperity for a long, long time, and am delighted with the level of understanding that they have about what should be being done in our country and what shouldn't be being done in our country. Um, I've always appreciated the effort that they have put into it. You are a true grassroots organization. You do a terrific job of educating your members and helping them do what constituents should do, which is let their representatives and senators know that they're there and that they understand what's going on and that they will hold us accountable. So I'm very pleased with what you all do.
Yeah, I mean that's what drew me over here to Americans for Prosperity, to be honest. So it's great to be able to be part of an organization that does that, and we do it in a respectful way. So that means even more for us to be able to get good things done through the policy side. So thanks for
Absolutely.
that. So some of the stuff that's been going on, obviously, nothing major in the country, but
No,
nothing big. But we've seen some stuff from obviously from the healthcare side, and some changes that have come down the line. I'm curious if you could shine a little bit of light on what steps Congress is taking to ensure that more North Carolinians have access to affordable, quality healthcare during this public health crisis.
well, we all know that we're facing the most unusual situation that we've ever faced in this country in terms of health care. Uh, and it's something that is not of our making. This COVID 19 came to us from China. It is a shame that the Chinese did what they did to allow this virus to get out. Had they done things right, it could have been contained in China. The world could have been warned, and it could have been handled a very, very different way than it has been handled now. But we've had a combination of reaction from the government. I have to say that uh, the president, by banning people from coming to China early on, did a good thing. By banning people from coming from Europe, did a good thing. But then we had to deal with the fact that it was in our country. And what we need to do is to create a patient centered system. Republicans have been talking about that for a long, long time. And getting the government out of the way is the number one thing that we need to do. We need to turn this back into um, patient centered, patient choice, the government not being in the middle of healthcare. And the one major thing that I think is going to come out of this, I think, Chris, is that we're going to see how much innovation has occurred through the private sector as a result of this, and that it hasn't been the government that has solved the problem. Again, had we had, I think, a different president than we've had with President Trump, we would have seen the president try to solve this with the private sector and with the government sector, and that would not have worked because it was the government that failed us. Everywhere from the NIH to the CDC, the government was not prepared for this. There was not the equipment available to people. Um, and it's the private sector that is going to solve this problem. And the more we can get the government out of the way, the thing I started to say is reducing rules and regulations. What the administration has done is been to push the FDA, push NIH, push all the agencies to speed up the processes in every way. The more we reduce rules and regulations, the better off this country is. And again, those rules and regulations don't come from the private sector, they come from the government. So, what we need to do at the state level and at the federal level is empower North Carolinians to make choices. When Obamacare was passed, all that did was remove choices to people for how to choose health care, health insurance, and health care. What we need to do is go back to the way our country operated before we had Obamacare, and we need to institute more choices at every level that we possibly can.
Yeah, that's fantastic. That's one of the things, right? I mean, it's market signals, and the more options that we have, the better it's going to be. We talk about access to care, and actually providing an environment where people can innovate and provide more access is an important piece to all this. So I appreciate everything you just said there. Um, you know, to piggyback a little bit on that, along the way, Congress recently took some steps to expand access to telemedicine and telehealth technologies. Do you think those policy improvements are helping North Carolinians respond to the coronavirus? And what do you see going forward in that?
Well, I think telemedicine and telehealth technology have been godsends for us. They really have been. Just look at what we're doing right now. I
Yeah.
mean, we could have a meeting, you and I, and we could have taped this, but we don't have to do that. You don't have to leave your home. I don't have to leave my home. We can be communicating. You know, that term social distancing, I think, is wrong. Physical distancing is what we have done, not social distancing. I'm telling you, I'm on the phone about 9 hours a day, or in team meetings, or Zooming, or any one of the other things that exist out there to allow us to communicate. And so, telehealth and telemedicine, um, everybody's drugged their feet on those innovations in the last few years. Frankly, I think there have been lots of factors in that. Um, Not to dismiss what role the providers may have played in that, but I think people have gotten much better, much more comfortable with it now, and we need to be using it. I had an email from a constituent. You know, Chris, I answer my own mail. Every night I sit at a computer and answer letters and emails that have come in from my constituents. It's a wonderful thing for me to do, I think. I think I'm the only member of Congress that does it, that answers all the mail. And I had a constituent write in and say, you know, I I want to get my physical therapy through telemedicine, but the government is not paying the physical therapist properly. Can you help us with that? The next day, we contacted CMS to say, why are you not doing this? You should be doing this to encourage telemedicine. I can see very easily, having used a physical therapist myself, I can see very easily how easy that would be to have the physical therapist show you the stretches you need to do, the moves you need to do. That is so easy to do. You wouldn't have to go into an office, saves an enormous amount of money. You could even do it easier in groups in telemedicine. So we found out. I mean, we started getting in touch with CMS. I don't know that it was my telephone call to them and why we wanted to talk to them, but the next day they issued uh, um, a statement saying they were fixing this and they were going to be paying people on time. And so it is really something we should be doing. Um, I have complained for a long time. Don't mean to tell my whole history, but I use a CPAP machine. And I was forced to go in and talk to a sleep doctor. And I complained bitterly about that. And I said, the doctor never touches me. All I go in is he tells me what's happening with the CPAP machine because they monitor it remotely. I'm truly not too comfortable about that, to tell you the truth, but I know they're doing it for my own good. And I have terrible sleep apnea. So I complained to the doctor and I said, I'm not coming back here again. If you want to call me on the telephone, tell me what you want to tell me, ask my questions, I'll do that. But it was taking me an hour to drive there, an hour to drive back, taking up a lot of time. That is a perfect way to handle telemedicine. So what we need to do, the barriers that have been removed during this emergency should be kept removed. And we should look for more ways. You know, Chris, I'm a huge believer that the government does nothing better than the private sector. I've said that over the years, and I'll ask people, do you know anything that the government does better than the private sector? And a lot of times they'll say, oh, an army. I said, no, not even an army, because if you had mercenaries, they'd be much more efficient. I don't want mercenaries for our army or our military, but no, the government never does anything more efficiently than the private sector does. And by keeping us away from telehealth, the government has kept us away from an efficient way of getting health care. Chris, I'm sorry, I can't hear you.
Sorry. I'm glad you brought up physical therapy and everything there. My wife is a physical therapist and she does home health. So she's in people's homes day in, day out in assisted living facilities and things of that sort. And an interesting piece to what you said there too, especially during this pandemic that we're having. She serves or she helps her patients have telemed consults with their doctors while she's at their house. She's helping facilitate
Right.
that through their equipment, because not everyone has obviously the equipment. They're doing it, and the feedback that she's gotten was, these folks love it. They feel safer not having to go into their doctor's offices during when everyone's sick. It's easier. To your point, it saves them time. It saves money from the travel and everything. So I just really appreciate what you said on that front. It really hits home, especially for me, because I hear my wife talk about it every day.
Well, let me tell you, I've become a devotee of physical therapists. I was having problems about a year and a half ago, and one of my colleagues recommended physical therapy, and it was that or surgery, and I haven't had to have surgery, so I'm a huge fan of them, and I'm happy to make commercials anytime because they're doing a great job, and it's much less expensive.
Yeah, it is. It is. And that's the big thing with her. She feels that she's helping people, live better lives because they're able to get around and be independent and be efficient on their own. So it's a good thing. But it's fantastic that we're getting to that point in healthcare innovations where we're able to hopefully do that in the future and do more of it through telemed, making it more accessible to more people to be able to do it. So exciting stuff. Let me kind of pivot a little bit here. We've been talking a good bit about the funding aspects of what we're doing for COVID-19 from a federal standpoint. One of the things that we've been talking about recently is something the Senate is looking at bailing out decades of poor budgeting from several states. In a lot of cases, none of those funds are actually going to those hit hardest by COVID-19. What are your thoughts on that? What are your thoughts on the bailouts for the states and how that should be applied?
Well, my thought is we should never bail out a state. That's number one. I would never bail out a state. What we're doing, and I tell people this all the time, when the federal government gives money to somebody, that is taxpayer dollars, hardworking taxpayer dollars. It is not manna from heaven. And so states and I'm glad states have balanced budgets in not amendments, but balance the requirement for a balanced budget in their constitutions. I'm a big believer in balanced budgets that don't allow you to raise taxes to balance the budget. That that's where I am at the federal level. But I am not in favor of bailing out states, particularly those states who have been irresponsible. Um, we've already appropriated a lot of money that's gone to the states. I don't have my notes in front of me, but I could get them for you. I could give you an outline of all the money that's gone to the state of North Carolina, for example, to help with the COVID-19. Uh, but we should not be bailing out irresponsible states. Let me brag a little bit on North Carolina. Um, you know, when Governor McCoy was elected, we had, I think it was $3.5 billion debt to the federal government for unemployment insurance because of irresponsible budgeting that had existed under the Democrat legislature, Democrat governor. Dale Falwell became the head of that program, and Dale was able to work out a program, and our businesses paid more, which means if the businesses are paying more, their employees are not getting that money, but they paid more to pay back that debt. And then I believe they put in about the same amount of money in the bank so that when something came along, like this crisis we have now, they would have the money to pay unemployment insurance. The legislature's done the same thing. And again, I'm not in the legislature, so I don't have the exact dollars. But every year the Republicans have been in the majority. The Republicans have put aside money in what we call a rainy day fund. Well, by golly, this is a rainy day. And now our state is in good shape to handle these things. And that's what every state should do. But you have irresponsible states. Illinois, I think, is the worst. New York is among the bad ones. They're all states that have a lot of unions in them, and the unions have coerced their legislators. They help elect people who support the unions, and it's a vicious cycle. And so they give them more and more benefits. The retirement costs are out of control, and so they're in trouble. They're particularly their retirement funds, and so they want the rest of us who've been responsible to help bail them out, and that's just wrong. You will not force people to be responsible if you keep bailing them out. You know, we operate in this country. The individual people in this country are very benevolent toward their fellow citizens. You can see it. You see it in rural areas in particular. But again, we saw it in New York when 9/11 hit. People stepped up. They helped their fellow citizens, even in a city. But in my district, for example, somebody doesn't have insurance, the fire departments, the Ruritan clubs, all of them will get together, help with expenses. We do that as individuals, and that's the way it should be. The churches help. There are organizations, but if North Carolinians are asked to bail out Illinois' government because it has overspent, the people in Illinois will constantly look for that handout, and they will not hold their elected officials responsible. That's the way it should be. We all should be held responsible for our own actions and not ask somebody else to take care of us.
Wow, great answer. I agree with you 100%. We talked about the Illinois bailouts as well, and frequently about in this issue. But to your point, very well, that North Carolina, in talking with legislators here in the state, they've made a lot of tough decisions early on. It's easy to spend a lot of money. It's unpopular to not spend money, and
That's exactly right.
they made a lot of unpopular decisions for a while, and it put us in that great position that you were talking about. And I'm sure most North Carolina taxpayers wouldn't be crazy about paying the debts of other states because their states didn't budget properly and fund things properly. So with you
Well,
100%.
one of the things we also have to do, Chris, is make sure again we are not passing down to the states unfunded mandates. Now, the states will argue that they should get help because we've passed the federal government has passed unfunded mandates to them. I have a great bill that I've introduced several times. It's actually passed the House 4 times, called the Unfunded Mandates Information and Transparency Act. Um, it will help us with reducing unfunded mandates from the federal level. The Republicans, when they got in the majority for the first time in 40 years in 1995, passed the UMRA bill, which was the unfunded mandates bill, but there were lots of loopholes in it. This would be the first opportunity to close those loopholes and also force the bureaucracy to be honest in what it is asking the states and localities and even the private sector. For the first time, what the private sector is being asked to do to take responsibility of the federal government. What federal legislators like to do is say, well, this is a great idea, but we don't have the money to do it. So we'll just tell the private sector to do it, or we'll tell the states, or we'll tell the localities to do it. We need to stop that. And I've pushed this issue for a long time. The counties want it, the states really want it. Lots of organizations in the country want it, but the legislators at the federal level don't want their hands tied, and particularly the bureaucracy does not want their hands tied. They want to be able to continue to do what they've been doing for a long time. So I want to commend UMETA. Doesn't have the catchiest title in the world. It's called UMETA, Unfunded Mandates Information and Transparency Act. But it is a terrific bill that would help us with not passing down unfunded mandates away from the federal government to the private sector and other branches of government.
It sounds great. It sounds great. I hope everyone who's listening to us today, that you guys will take a look at that as well. So anything where we don't have the mandates coming down, that you end up having to figure out, how am I going to pay for this once we get it, will be a relief to most state budgets, I would think, from that point. Well, I don't want to take up all your time, Congresswoman. I appreciate you spending some time with me today. It was an absolute delight. I hope we can do it again. I hope to have events when we can actually get out and be about in your district, to be able to meet some of the activists out there and talk to them. Anything that you want to close us out with?
No, I just want to say again, I appreciate the educational effort that Americans for Prosperity puts into your work and how you educate citizens. I happen to think that we're very lucky in North Carolina right now, particularly with this COVID-19. We haven't had that many cases based on the population in our state. And I think that's because we got a lot of smart people in North Carolina, because they followed the instructions and they've done what they were supposed to do. And in almost all the cases, the problems have been with people with comorbidity or people in nursing homes where diseases unfortunately travel very quickly. And I think once we see all the statistics, we will see that while we needed to do this, we can deal with this issue in a much better way in the future. And I just want to commend all of your members for being the smart people that they are, for being involved and wanting to educate themselves. And look forward to doing more of these with you. I'm happy to be available. The best thing that any of us can do is to help educate our constituents and to be available to them. And since we can't be available mostly physically, we can certainly be available by phone and by this mechanism.
Perfect. Well, I look forward to it. Thank you again so much for taking some time with us this evening. Look forward to many more in the future.
Thank you so much, Chris. God bless you.
Thanks. Have a good evening.